her son, older than Maya, he also has sickle cell.
Her son
Had a
tends to have
great
more
episode, yeah.
episodes, and sometimes she will call and say, my son is home, can you go check on him or whatever, and then I go. So one time we brought it up and said, have you tried hydroxyurea? And she says, yes, I've heard about it, but I'm not really too sure about if I should take it or if I should go. I don't understand it the same way we felt before we tried it. So here's a drug that's being introduced to us, and we're being told that our daughter needs it, but we didn't understand it.
So it was just kind of a little bit of a hard decision to make to really put them on something that seems so serious.
The first thing that popped out at me was that it was a drug that was used for cancer patients. And when I saw that word cancer patients, it kind of made alarm bells go off for me.
But it's not used in the doses that you use for in other cytotoxic drugs. And it's been licensed for use in children with sickle cell disease at much lower doses.
A lot of people think that it's like chemo medication, but the dose that you're getting or your kids might be getting is, not comparable to what people being treated with cancer would get.
Hydroxyurea was an option that was explained to us and how it could possibly help us.
My name is Isaac Odame. I'm the head of the hematology section at the Hospital for Sick Children. Hydroxyurea was introduced in clinics for sickle cell disease in the early 1990s. So we've seen patients who've been on it for 30 years and over.
Oh.
And we haven't seen any of the dreaded long-term complications that people worry about. No increase in cancer rates. We haven't seen any long-term effects. On the contrary, what we are seeing is improved lifespan and better organ function.
Should we start them on something when we don't really know how their sickle cell disease was going to be for them? Maybe it wasn't going to be so bad. We just thought maybe we should just wait a little bit.
By the NIH guidelines, we should start at 9 months old, but we find that sometimes if we have patients who are younger and they're having lots of complications, for instance 6 months or 4 months old who are having lots of complications, getting lots of painful episodes, then we'll start at that age also.
Recognizing that 9 months, most patients will not have painful episodes or any complications at that time. But what you're doing is trying to prevent it. But definitely at any age from 6 months onwards in patients who start with frequent crises or later on in life to prevent crises.
We just didn't want her to go through any of those severe conditions or pains.
We want to reduce sickle-related complications. And so with hydroxyurea, what it does, it increases the fetal hemoglobin and decreases the sickling hemoglobin. So therefore, the likelihood of sickling is less.
So fetal hemoglobin is the hemoglobin that we're all born with. We know that in some patients who have maintained their fetal hemoglobin levels higher than normal have reduced pain episodes. So what hydroxyurea does is increases fetal hemoglobin to mimic what is seen in those patients and so reduce the sickling episode.
We have to bring her to the hospital every so often. It's always the time away from work, the loss of weight. If she has to be admitted overnight or for a couple of days, somebody has to be there with her. So those were financially constraining.
Going through 1 or 2 sickle cell crises with our kids, being admitted one time, I think all of those factors played into the decision. Do you really want to do the best to try to protect them from, really being in pain?
For us was when she had she was at her worst moment.
The worst one, the one where they had to.
She was sent into an ICU and she had to get,
all those machines.
A lot of machines hooked onto her. Like seeing her in that state just made me say, you know what?
Let's try it.
Let's try it. We won't know unless we try. And we're glad we actually did.
If you have asthma, you would want to give puffers to prevent asthmatic attacks. In sickle cell disease, it should be the same type of consideration to prevent sickling episodes in future.
With each crisis, there's damage being done on these organs. It's going to help with preserving those organs long term. And, in the end, hopefully a better outcome and better quality life for your child. So
organ damage is less, so they're able to live longer.
Sometimes we only think about the pain crisis and managing the pain, but for us it was okay, if it's going to preserve their organs, that means better quality of life, and also better hopefully longer life expectations. So
also the overall hemoglobin of a patient sometimes increases with hydroxyurea, so they are less anemic. They have more oxygenation going to the vessels and going to the organs in their bodies, so they do better when they're on hydroxyurea.
If their energy is greater, they can do more, especially in children, more physical activities and without being as tired.
Patients who normally get admitted every month for a painful episode, when they're on hydroxyurea, we see that decreases by probably about half or none sometimes.
So they're making the decision because they want to keep their child as healthy as possible.
We obviously were concerned about possible side effects.
Of course, you should be having a conversation with your treating physician as to side effects related to the medication, how the medication is being monitored, and that should be a discussion before you start any medication on your child.
it has been studied in adults, but not so much in children. And so the hesitation was around, putting your child on something new that hadn't had like long-term, studies on.
When we were sitting on the fence, I remember it was when Dr. Ali provided the HUG study that we got a chance to look over.
The evidence was so conclusive that it didn't make sense not to put her on it. It was definitely going to be a benefit to her, just like it would be for cancer patients, to help increase their hemoglobin, to help increase their energy levels, and ultimately to change the composition of her red blood cells.
Time is valuable right now, and those discussions are really important.
I think initially I did connect with another parent to kind of help with making that decision. And so that was nice to kind of chat with someone else and hearing their own testimony and just kind of hearing how their experience was.
We trusted that proper research has been done on this medication, and it would really help her.
In terms of side effects, we didn't really notice anything that was really alarming. Maybe my daughter had a little bit of her skin, a little bit discoloration, but nothing really major.
And her body trying to adjust and get used to it. Obviously went through periods where she feels a little weak. Maybe because the medication was a little strong for her.
Initially she was always really tired. She's really tired and wanted to sleep.
Yeah.
Nothing changed within her. She's still Maya, still got a full head of hair. So, she's more lively, still bouncy, doing everything. She's just living a life like a normal child.
I think in the beginning, we just had a lot of unknowns, and just like sickle cell disease, there's a lot of unknowns. So we weren't sure what could be a side effect, what couldn't be a side effect. For example, if she said she had a tummy ache, sometimes I questioned it, or if she had a headache, I questioned it. But ultimately, she's been on the medication for over 5 years now. We haven't seen any side effects from the medication other than an increase in her hemoglobin, and her fetal hemoglobin is now at 29%, which is what we were aiming for.
Hydroxyurea is one of those medication that reduces your white blood cell count, so that makes the patient at high risk for infection. So they have to be monitored for infections.
So we ask our patients to have periodic blood counts done in the community or at the hospital, and follow the counts, because we don't want the white cells to drop too low to put them at risk for infections.
The blood work piece was a bit of a challenge because they have to get it done regularly.
White cells dropping is actually beneficial in some ways because it reduces the inflammation, which we know is part of a vaso-occlusive episode.
You know, the hematology clinic helped us to connect with a local hospital, not too far away, so that they can just do a finger poke for the kids versus having to go in their vein.
It increases the burden on the family of giving the medication, having the monitoring done, and coming to hospital maybe a little bit more than if they were not started.
It was a bit of, I guess you could call it an inconvenience, just thinking that my child had to do extra blood work to track it.
When she first started at Drexel, we went to Dr. Luther's clinic. It was every time we went, she had to do blood work. Now when we go, they'll do the weighing, they'll do the height, they'll do the physical checkup, and I've been with her where he didn't do blood work.
Which is good. It's less painful for her too.
Those are the days I like, Marcia, because then no needles are involved.
We know your needles.
Yeah.
Once we got into the routine, the place we use, we are able to pre-book our appointments ahead of time. So I can conveniently choose a Saturday morning when I know she's home and it's convenient for us to just go and do it. And we know like every month, this is when we have to go. This is where we go. Get it done. Planning it ahead of time has really helped.
It's actually made it a lot easier. I mean, it's less visits, less
Correct.
Appointments. Only when it's necessary, then we will go, to get her checked.
The first thing is you have to give a medication every day. It shouldn't be given only when having pain. It should be given every day because it works on developing red cells.
You can't just take it every other day. Make it a part of your plan.
You can't just leave it up to a child to take the medicine. So if parents are better able to monitor when the child is taking the medication, for instance, not to say, okay, on your way to school because the child might be too rushed or they forget, consider the time of day that they will be given the medication.
We try to set an alarm, and so that alarm goes off the same time every day to help us with remembering to give the kids. And because we have 2 kids that are on it, it's really important for us to kind of just get into that routine. Mm-hmm. So trying to take it at the same time every day, over time, it just became natural.
Just trying to get a young kid to try and take this medication when they needed to was always a challenge, right? Trying to access the liquid form was a bit of a challenge.
Finding a pharmacy that was going to be able to compound the medication, just finding one that, you kind of thought was reliable and close by as well.
It only comes in 500 milligram capsules in Canada. So we have the little ones who have a hard time taking hydroxyurea. So it has to be mixed by the parent by dosing and dividing the medication, and they're taught how to do this, or they have to get it done at the pharmacy.
I rather the liquid rather than mixing it. So
it just
it's
saves
more
the
of
time.
It's more of a preference.
Yeah.
It's not it's not an inconvenience
No.
or nothing like that. It's just more of a preference. Opening the fridge, put it in a syringe or putting it in a spoon, giving it to her versus standing at the counter and mixing it.
She also liked it, and that's the other thing we didn't know. We didn't know that when they compound it, they actually add flavors to it.
Yes, it tastes better.
Versus, so she got used to having that
Taste.
the taste that was added into hers. So it was just a lot easier to just call the pharmacy and say, hey, can we have another, a refill, and just go pick it up.
For us, the actual medication is covered, but the compounding part wasn't covered.
Considers such things that the cost to them, especially for the mixing, because that can pose a problem for many parents. We don't have enough pharmacy in the province or in Canada that does mixing because it's a special thing for the pharmacy to do. So therefore it comes at a cost to parents, the mixing. So that is one of the drawbacks for most of the patients, especially for the little ones who has to get small doses.
We don't get it compounded no more. We actually have to make it because the compounded one is not covered. Because with the new job, she's not covered with the benefit for it. So we have to get the capsules and then make it ourselves.
If it can be covered, because over time it will eventually add up. Like monthly, it is a lot, you know.
I think that will prevent people from getting it, but we're in a position where we can afford it. But what about those people that can't afford it?
So what we'll do is try to find them pharmacy that they don't have to pay for the mixing. Also, if for instance, if the mom is pregnant and she's going to be mixing the medication, that might be a problem. So then somebody else in the household may have to do that for them.
But there's no challenges in mixing it. It's very easy.
Yeah, I do the mixing, so yeah, it's easy.
So it's very easy. You can travel, without having to fear her missing a dose, because you can always carry it with you and mix it at any time and give it to her.
When we did transition to the pill form, it made life a lot easier. I remember we celebrated the fact that she took the larger pill form and it went okay. We were initially going to be traveling. That was a bit of a challenge when you had to deal with the liquid form when it was compounded. But once she was old enough and transitioned to the pill form, it was like anything else that she had to take. It was quite easy and very convenient and readily available as well.
Really just have to plan ahead to make sure we have enough of the medication and just obviously store it properly and that sort of thing. But
we made sure that our travel was either within that time frame, like to the blood test before we go, so that we will at least be back in the country and
before the next one.
For the next blood test is still, going through this as a first time experience. We're not sure what to really expect. We're told that this sickness affects people differently or children differently.
The doctors and nurses have been so helpful in answering any questions we have. I think I even called Melina or emailed Melina a few times saying she's experiencing this. Is this a side effect? And she'd say whether it was or not. And in the end, nothing was a side effect of it. So
with our fears and concerns, we're always making that phone calls, calling the team, calling the nurse. Sometimes we feel like we're bothering them a lot.
Yeah, so
we just had to. I mean, there was no other place to turn to. So yeah, we did receive a great deal of support.
So I think the surprise to it is just how great it works.
We haven't had any negative outcome for it. In fact, it's actually helping her a lot more.
She became a little more tolerant of the medication. Some of those side effects, started wearing out. She became a little more stronger, a little more active. They missed a whole lot of, time away from school.
I remember one definite difference also was, and I remember that was in the study, and I took note of that, where the number of hospital admissions that they emphasize in the study, and we've definitely noticed a decrease in that.
When they do get a pain crisis, we're like, we're typically not having them. So, maybe once a year.
I can't even remember Toby going through any crisis, like a serious pain where we have to go into the emergency.
Because they go so long without having pain, being on it, to be honest, that when they do have a crisis, that's really the surprise to us. And usually, for us, that means that they, need to up their dose. So, and typically that's what happens.
Most patients we are able to escalate the dosing without compromising white cell counts.
She didn't really have any crisis until recently. She had the flu, and unfortunately that dropped her counts a bit, and so she actually had to come off hydroxyurea for a little bit.
And don't get me wrong, there are days that she wakes up with pains, but I'm sure it probably would have been worse than what it is today if she was nowadays or was on something else.
So the hospital visits are not as scary. Like for me as a parent, you go in with your child. Before hydroxyurea, whenever we went to the hospital, it was like,
we'd pack a bag because we knew we were going to stay at least a week.
You stay longer, and also the other thing is she's worse. And then we have to go through so much ordeals for her to get better. But now it's just, she goes in, she hasn't had a blood transfusion in, a couple of years now.
Yeah.
That's one of the biggest difference that we notice. She only goes in there, she gets her, she gets put on an IV and antibiotics and whatever to treat whatever it is that she's fighting.
The emergency visits still happen when she has her fever, but we haven't had to stay overnight in years, which is huge. So obviously, less sick days for her means less sick days for us. We haven't missed work often, which is a huge bonus. Also, when you have other children, it becomes an issue with scheduling who's going to stay home, who's going to stay at the hospital. So that's been a game changer for us.
Yeah, and also you don't have to keep getting calls from the school saying she's not feeling well or she's sick and whatever, come get her. She's at school having a fun, enjoying her life. It's a lot, it's a lot better and it's a lot easier for us as a parent too.
This is the only medication that we have found for a sickle cell patient that decreases the sickling and increase your fetal hemoglobin, thereby giving you nice round red cells that were easy to pass through the vessels. So the likelihood of your child sickling or having lots of pain or having organ damage when they're on hydroxyurea is lessened. You come into the hospital with your child, you will be missing work and stuff like that. That also is less when your child is on hydroxyurea. Kids going off to university, they're better off when they have high hemoglobin because it also increases your regular hemoglobin. So therefore you're able more to function, you're less anemic. All of those good things are hydroxyurea does.
We pretty much live an almost normal life now.
I'm less worried now,
We started feeling more comfortable also about her, engaging with other kids and participating in sports or other activities because we were more confident with how the medication was affecting her in a positive way.
Our patients have been even able to participate in sports, track and field athletics, which historically no patient with sickle cell disease would ever consider because of the fatigue associated with the disease. So that to me is a big plus and why we recommend it in the clinic.
She is doing things that we had we kind of sheltered her from before because we thought, I don't want her to have close contact with people. I don't want her to get sick. If she gets sick, it's a hospital stay. Now it's just, there's a little hiccup in our plans when she gets sick. But like I said, the fevers are 24 hours compared to 5 days, which is a huge change in our lifestyle for sure.
In this season, which is the winter season, she gets to enjoy a little bit more outside with her sister, like snow time. Before, I wasn't letting her go outside in the winter months because I was so concerned that she would fall into an episode, right?
I've been managing patients with sickle cell disease for 20 plus years, and it's really wonderful to see children being as normal as any other children in terms of physical activity, academic performance, doing well in life. Their quality of life has really improved since we have access to hydroxyurea.
Because it creates new blood cells, so we don't have to worry about her like getting tired and not being upbeat and playing whatever. She's just a normal kid. You wouldn't even know that she has sickle cells if we didn't mention it. Like whenever we go out, nobody knows. Okay?
You can hardly physically tell that she has sickle cell, or she has this condition.
If people didn't know that she had sickle cell beta zero thalassemia, they wouldn't know it from seeing her.
She looks much stronger, much healthier, and she lives a very active lifestyle, like every other child,
Her energy level is high, and that she's been doing sports. She's been active in the community, doing theater. She's a great student at school. She's changed a lot.
And she actually eats now, and she will eat the entire lunch, right? So, yeah, her appetite.
That makes me happy to see children being just like anybody else.
If you're curious about something, ask questions. In the beginning, I think I was shut out from asking questions. I thought I knew everything. But then after asking questions and talking to the doctors, talking to the nurses, talking to my husband, doing our own research as well.
Reach out to other families that have been on it to hear about their experiences.
Just speaking to other people that have gone through the experience has also been helpful.
There are lots of supports as well. If finances is going to be an issue.
Having these kind of direct conversations really do help.
The medication doesn't come standalone. It comes with a group of supporters, as in your medical team or your family physician.
That definitely does help tremendously, just to have that support system in place.
So I would advise families that have a child with the same condition to give it a try.
They don't knock it before you try it. That would be my advice.
After 6 months, you'll see the good effects of hydroxyurea. You'll see that you don't have to be coming to the hospital so often for a painful episode. Your child is not admitted a lot. It's hard for parents to see their child in pain and they can't do anything about it. So this would be less.
If your child is not responding, very well to it, then talk to the team and see what else they need to do. If it doesn't work, then the team knows best or better. It might take a little bit of time, but it would work.
You don't just start the medication and it start working right away.
This is a wonderful medication. I call it the wonder drug for sickle cell. When you look at the overall effect of hydroxyurea, it does work for sickle cell patients and makes them have a better quality of life.
Much happier, because she's healthier, obviously.
It's the best treatment available right now. Obviously, we hope for other treatments.
Trust the doctors. They know what they're talking about. Trust the medication. Give it a chance. Because you don't know what the outcome would be until you trust it. We were scared, we were fearful like everybody else, but we gave it a chance and we saw the difference that it made in our daughter's life.
It was probably the best decision we could make, is just putting them on this medication.
We realized we were doing our daughter a disservice by not putting her on hydroxyurea.
We have a lot to be grateful, and thankful, to ourselves that as parents, we were able to give her that ability to be who she is today, by making that decision for her.